Hi, my name is Karen Flood. I'm one of the fetal medicine experts working here in the RCSI Department of Obs and Gynae. There have been a lot of questions about the ultrasound schedule for somebody who's experienced recurrent pregnancy loss. The Acorn Clinic in the Rotunda Hospital, which runs this service, sees people every 1 to 2 weeks depending on anxiety levels, and usually you're kept in the clinic until about 12-14 weeks until you make your booking appointment in the public or private system. If you've had second trimester losses, extra scans are facilitated within the hospital, and indeed if you've had pregnancy loss related to premature rupture of membranes or going into labour early, you'll be engaged with the preterm birth clinic, where also your cervical length will be measured by ultrasound too. If you're found to have a low placenta or placenta previa at the time of your anomaly scan, the standard of care is to repeat the scan at about 34 weeks to see if the placenta has moved, and thankfully majority of times the placenta has moved to a safer position. If the placenta is still low, then more frequent scans will be arranged until your delivery timing is arranged. There was a specific question asking about kidney disease and the role of ultrasound in detecting reflux. As part of the anomaly scan, we do assess the kidneys, and if there's concerns about extra fluid in the collecting system of the kidneys, follow-up ultrasounds are arranged for the rest of the pregnancy. Oftentimes nothing else needs to be done except for linking with the paediatric team post-delivery for further ultrasound, and at that time reflux, etc. might be picked up.
Hi, I am Fiona Cody and I am a specialist sonographer in Obstetrics and Gynaecology. I work in the RCSI Rotunda Department of Fetal Medicine and Ultrasound. Our national guidelines, very recently published in 2023, in line with international consensus, is that women should all be offered 2 scans in pregnancy. One scan is called the booking scan or the first trimester scan, and we aim to do that scan between 12 and 14 weeks. The aim of this scan is to confirm an intrauterine pregnancy, to confirm a fetal heartbeat, to get the gestational age of the baby correct and give you an estimated date of delivery, and you've heard the term EDD, and also just to confirm there is a singleton pregnancy or a multiple pregnancy. The second scan that you will be offered in pregnancy is between 20 and 22 weeks. And this is called the anatomy scan or the fetal anomaly scan. This scan will take about 30 minutes, and the aim of this scan is to detect any structural malformations or pregnancy complications that we may see at this time. The sonographer or radiographer who has an MSc in ultrasound will perform this scan and may take up to 40 images of your baby from head to toe. All the structures will be viewed: the heart, the spine, all the organs, the fetal size, the placenta, and hopefully a normal structural scan can be confirmed. So you may be offered other scans in addition to this, depending on your obstetric team. The doctors who you see may prescribe other scans also in pregnancy. If you have complications in early pregnancy, you'll be scanned several times. If you have a recall on your anatomy scan where they can't see everything, you will be recalled to approximately 2 weeks later to confirm normality of some of the other structures that were not seen. You may have concerns around fetal growth if you have gestational diabetes, or if you have fetal growth restriction, you may require many other scans. You also may be prescribed a fetal echo scan, which we do in our department to check the baby's heart, but those scans are only done in very certain circumstances. Other scans in late pregnancy will be at the request of your clinical team or your obstetric doctor. So the other part of that question was, can I get extra ultrasound scans in pregnancy? And the answer is no, not really, not at patient request. While we understand that patients seek reassurance, it is up to the clinical team looking after you to order the scans and prescribe scans. It is not something we can accommodate in our services to give reassurance scans to patients. Ultrasound uses high frequency waves that produce the image. These high frequency ultrasound waves are beyond human hearing and are safely used in pregnancy. So to date, no known detrimental effects of ultrasound have been reported in over 50 years. Ultrasound machines, especially newer ones, have higher acoustic output and certainly need to be used with caution. The mechanical indices and thermal indices are monitored by the people who use the machines, and only qualified radiographers, sonographers, midwife sonographers or fetal medicine doctors are qualified to use machines and to take ultrasound examinations. Other types of imaging used in pregnancy are MRIs and magnetic resonance imaging. This is only at the request of specialist fetal medicine teams in conjunction with paediatric teams at our multidisciplinary meetings. So rarely are MRIs requested or used. No other imaging is used really in pregnancy on a baby. There are many reasons why you may be needing pregnancy scans in addition to the 2 scans that everyone will get. In early pregnancy, for example, if you have bleeding or complications, or we're querying an ectopic pregnancy, then of course you'll need multiple scans to confirm that all of these things are normal. At the anatomy scan, you may be prescribed by the sonographer doing the scan further scans. They may call you back to view some of the structures they haven't seen correctly and confirmed normality in those structures, and usually that would be 2 weeks later. They may also require you to come back for growth scans or for placental localization. So if the placenta is deemed low at 20 weeks, they will call you back at 34 weeks. And just to note that 95% of cases, the placenta has moved by the time 34 weeks scan is done. So that's good news. In late pregnancy, you may require other scans also for position of the baby for delivery, or again growth scans, or if they're concerned about the fluid around the baby. There are many other reasons you may need scans, such as fetal echo scans, and again they're a very specific group of people that would need those scans in pregnancy. If you require an extra scan or you wish to have a reassurance scan between 12 and 20 weeks, can you request it or pay for it? The answer is you can't request a reassurance scan. Our sonographers are very busy and our resources would limit that option. However, there are several private pregnancy scan units in Dublin and around the country that will allow you to book in and pay for your own private scan if that's something that you would like to do. So we would say there are no particular scans you would be offered as a result solely of your age, like over 35. This is termed advanced maternal age, and there are some pregnancy complications associated with women over the age of 35. One of those things are there is a higher associated with genetic conditions. There is a very good screening test available privately called an NIPT, or non-invasive prenatal testing. Here in the RCSI Rotunda unit we provide that service. It is not on the public service, it is an opt-in service. This screening test involves a maternal blood sample and a scan, and we send the sample off and get a result usually within 10 days, which is high or low risk for the common chromosomal conditions in a fetus. These include trisomy 21, which is Down syndrome, trisomy 13 and 18, and other common chromosomal conditions. So this option is available, but not on our service. We have applied our own fetal medicine team through the national screening body to request that this is made available to all pregnant women a number of years ago, but this service is currently unavailable in Ireland on the public system.